My topic is Antimicrobial Resistance Physician's Perspective. But before starting with the real topic, I just wanted to mention that Professor Walia has given such a nice talk that she has covered almost the chapter of antimicrobial resistance, including the treatment and then policy and everything. Now at the end of her talk, I feel that the food has been served, and then now my part will be to just serve the salads before at the end of the meal. But I'll see if how much I can, because everything has been covered. Resistance is a growing threat that all of us are very familiar with. So, and it's okay. So today, the contents of my talk will include introduction, definition, factors, control strategies, and the conclusion. So, resistance to antibiotics is now recognized as a public health threat of an unprecedented scale. So, resistance is responsible for millions of deaths worldwide and major health concern for the 21st century. And we are expecting about 10 million deaths annually by 2050. So, an AMR threatens the effective prevention and treatment of an ever-increasing range of infections caused by microbes. So, with this, the financial burden to the country and to the world is increased. See, on the side, these are some of the clippings published in the Times of India, where they have mentioned about the alarming statistics of antimicrobial resistance. So how we see the antimicrobial resistance, what is it? The antimicrobial resistance is the ability of a microorganism to stop an antimicrobial from working against it. So these are the factors. These are again environmental factors, prescriber-related factors, patient-related factors, and drug-related factors. Environmental factors is one of the most important factors. Huge population and overcrowding. And then because of that, there is rapid spread. If there is any infection, the spread is very much rapid these days because of the better transport, as we are seeing earlier. Even in Manipur, we are not able to see dengue fever. But now we are seeing dengue, not because the mosquito is seen here, but because the organisms are coming directly through infected individuals to this state. Again, poor sanitation, increase in community-acquired resistance, ineffective infection control program, and then widespread use of antibiotic in animal husbandry, agriculture, and as medicated cleansing products. Say, all these livestock earlier, all were naturally rare, and then there is no use of antibiotics. But nowadays, because of the rearing in the artificial environment, and then antibiotics are used very often in rearing all these animals, birds, and even foods. And so, when these products are being taken by us, the chance of, again, inducing resistance to ourselves is high. Then this release of large quantities of antibiotics into the environment, luckily we don't have this menace in our state. So this improper waste management by the pharmaceutical manufacturing units can be one of the factors for antibiotic resistance. Drug-related factors, over-the-counter buying of the medicines. So the antimicrobials are easily assessed. It is easily accessible to the patients, and so there is lack of restriction, lack of lows, and because of that, the chance of resistance is high. Self-treatment, say it is very common for common infections to go to read to the Googles, for example, and then take the treatment. And substandard drugs causing suboptimal blood concentrations. Suboptimal drugs, many of the drugs are not properly standardized, and so many times patients are given substandard medicines. Because of that, the blood minimal inhibitory concentration of the medicine is not achieved by these antibiotics, and so the chance of having resistance is more. Irrational fixed dose combination of antimicrobials, then increasing use of antimicrobials. Increasing use when the antibiotics are not indicated for many reasons. Antibiotics are being used by the patients, and so these are again another factor for the antibiotic resistance, development of antibiotic resistance. Patient-related factors, lack of education. It is one of the most important factor in the causation of antibiotic resistance. By lack of education, patients will not have any idea how to take, when to take, and then what is the importance of the medicine, and then what are the dangers of not taking the medicine in a proper way. And so there will be poor adherence to dosage regime. Poverty is one when they will buy only a small antibiotic. They will, instead of buying 15 or 20 tablets, they are going to buy only 2 tablets. When the symptoms are better, they will stop. And then if here in India, especially, what happens? A prescription is being, passed from patient to patient, and then these prescriptions are being used for one similar complaint. If a patient is having fever, and then the other one in the neighbor will ask that patient, last time what you took, then by what medicine you became all right. So the patient will show the prescription. Then he will copy that prescription and he will go to the chemist and then buy the medicine, and then he will start using the medicine, whether this medicine will be suitable for that disease which he is suffering or not, that he will not understand. This kind of rotation is very common in India and also in Manipur. We see many patients coming with that. The same prescription is being circulated for many months. And so self-medication, going to the counter, buying medicine, and then lack of sanitation concept. So education in all the fields, in every component is very important. Then prescriber-related factors. Over-prescription of antimicrobials is especially common elements. Say, many times, antibiotics are given in common cold. Say, when today someone is suffering from just running nose, rhinorrhea, then patient will be given antibiotics, azithromycin. Then sometimes not only oral, then will be started with ceftriaxone injection. This is a very common phenomenon, common type of treatment we see in many centers, may not be in the big hospitals, but especially in the centers, sub-centers, community centers, may not be by doctors, or maybe even by doctors when the training is less, or maybe by the other health workers, health supporters. This type of giving antibiotics without any indication is common. And patient's expectations. Sometimes the doctor feels that, okay, the patient has come with symptoms, and if I don't write antibiotics, what the patient will think. Or what means, if I don't write antibiotics, he or she may think something, and so maybe he will go to another doctor. So I may add one antibiotic. So patients, that sometimes doctors do to satisfy patients' expectation, not to react or not to give the proper description, proper prescription to the patient. Increase empirical polymicrobial use. So broad spectrum antibiotics using to cover, okay, if the patient is coming with fever, then we give antibiotics which will cover all the infections, or typhoid, then pneumonia, then if there is some pain, abdomen, maybe colitis. So the habit of using empirical polymicrobial, anti-polymicrobials is very common. And so this is again one of the main causes for development of the antimicrobial resistance. Inadequate dosing, as I also have mentioned already, inadequate dosing. And so all those prescribers are required to have current knowledge and to update their knowledge, and then they need continuous medical education and training so that they are updated with the changing scenario of the infections in the country or in the world, or this one. So this is a resistance which we are going to see. This means predictions. So this is what we are expecting from now to up to 2000. See, we are expecting 100% resistance, and then as we also know that the number of new antibiotics are less, and so there is no newer antibiotics now. These are common resistance threats we are facing these days. So all this infection resistance has been spoken earlier. So this is a little bit of the resistance which we see in India, and then comparing with the United States, that is up to 2010. And so what are the strategies to contain antimicrobial resistance? This has been spoken in length by Dr. Walia, but I will just cover a little bit of the highlights. So what we need now is judicious use of existing antimicrobial agents. Existing, because we are not having many, and then we are not expecting to have anything more. So that is what is most important, that is antimicrobial stewardship. It is a set of commitments and activities designed to optimize the treatment of infection while reducing the adverse events associated with antibiotic use. So these are, again, has been said properly, stewardship team, and so all in the hospital, all in the community, they have a role in preventing antibiotic resistance. So starting from the administration, infectious disease specialists, and then clinical pharmacists, here they have not mentioned about the family. The family also, not the one who are working in the hospital or not the one who are working in the centers, sub-centers, but the family itself, it has got a major role in preventing the antimicrobial resistance. Proper hand wash, proper sanitation, then proper, So proper sanitation, then to give the medicines in time, to give the medicine in full course in those patients who are not admitted in the hospital. So the family has got a major role. So everyone in the community has got a role in the prevention of antimicrobial resistance. This one has been spoken in length, and so to conclude, I say Antimicrobial resistance is a serious global threat. Not all infections need antibiotic treatment. Narrow-spectrum agents should be used whenever possible. Broad-spectrum agents should not be used as a cover for lack of diagnostic precision. Antibiotics should be prescribed in optimal doses, regimes, and should be stopped when the infection is treated. And clinicians should be familiar with local antibiotic sensitivity profiles. Thank you.